with Dr. MattWallace from the Regenerative Center. We're going to continue our conversation on chronic pain.
Yes.
So, what are the most common chronic pain things that you hear?
Conditions?
Yes, conditions.
I would say, you know, in our clinic, we see mainly spine, if you had to list them in order, spine-related issues. And I think the studies say that 80% of people in their lifetime will deal with some kind of neck, back, some kind of spinal issue. And there's a million therapies that they go to. So it's one of the most expensive things to our healthcare system to deal with the pain of that. And then you got joints like knees. Here's a knee joint. There's arthritis in this knee. So yeah, this is going to cause pain and, you know, eventually surgery and things like that. You got then shoulders and smaller joints. And then you have real stuff like big stuff like neuropathy is a big one. That's one of our best protocols. We see some of the best changes with neuropathy. And that's just a devastating condition to develop where your small nerves in your legs and sometimes in your hands, they start to kind of die. And as they do that, there's pain, there's numbness, tingling, balance, control issues. It's a pretty devastating problem.
Well, I've got a friend that's gone through chemotherapy and she has some neuropathy, so that might be something that she could come talk to you about.
Fantastic solutions for neuropathy, and it's not just giving pain drugs and things like that either. You can actually, there's some new stuff that's proven to help with that, so we do that in our clinic.
So I have to ask, is there anything that doesn't respond well to this?
Oh, of course, we always have the few that don't respond, and typically, when somebody doesn't respond, it's usually the condition is so far advanced that there's just limited ability to do much with it. Another one would be comorbidities, when there's somebody's just got so many other health problems that their body's just kind of sick and there's not a whole lot to work with. Or autoimmune, we actually treat autoimmune problems, but if we don't treat the autoimmune problem but we're trying to fix something else, again, slow healers, there's a lot of medications they're on can alter that. And then there's a lot of people that just don't put the effort in. They want something that, again, we're back to the pain cycle. They want something quick. They want to feel better tomorrow. But sometimes this takes work. We have to develop things. We sometimes have to wear a brace for a while to let the cells do their job and the right kind of physical therapy. And some people just went out of pain quick.
So if we're willing to put in the work, what should we do?
If we're willing to put in the work, step one is when you come to our clinic, we are going to educate you. You have to learn what in the world is wrong with me. And so that's step number one. So you can call us. 50% of our patients come from more than 2 hours from here. And so they'll come, we'll talk over the phone, we'll get their MRIs and talk to them, discuss things. We actually have a seminar. We do a seminar about once a month. We have one in Bowling Green this weekend. There's, I think, over 100 people coming to that. So we go out and educate people. So we're always willing to educate. Give us a call. We can set up a case review with you and just help you to understand what is wrong. So many people say, I'm just so frustrated, nobody's gone on my MRI with me, they haven't told me, they just told me what to do, but they haven't discussed it. And that's not going to be what we do. We're going to help you to understand what's wrong.
And we don't need a referral?
Don't need a referral, just give us a call.
All right, thank you so much for clearing a lot of that up for us. Very interesting information. If you would like to revisit this segment with Dr. MattWallace from the Regenerative Center, log on to WPSDlocal6.com/familyhealthexperts.
Thank you.